So welcome everyone, thank you for coming. I normally give a lecture called Controversies in Dentistry, but unfortunately it's a 2-hour lecture that I can never finish. So I decided today to do a little change of gears and talk about the one subject I get the most questions on, which is root canal therapy. So who here has heard or read or someone told you that root canals are toxic and they cause problems? Okay. And has anybody had a root canal that was done and was never right and got infected and yet that had to be extracted or redone with surgery many times only to lose it? Okay. This is unfortunately a very common occurrence. Okay? And so today we're going to talk about kind of demystify root canal therapy, talk about modern alternatives to root canal therapy, and I think after this lecture today, you'll all walk away with a full understanding what's going on. I'm going to demystify what happens during root canal therapy and where the problems occur and what the solutions are. Because fortunately today, there are new technologies that are available that weren't available even 5 to 10 years ago. So everything you read about root canal therapy is always about conventional root canal therapy, which is wrought with problems. So, and by the way, if any of you have a question and you'd like to ask me the question, we'll save it towards the end, and I promise I'll answer all your questions. Okay? So, for those of you who don't know, this is an X-ray of root canal, and so I don't know why this isn't working, because my battery's probably dead. Anyway, so inside you see there used to be a nerve, and now it's filled. So that's what a root canal looks like on an X-ray. Okay, so what all of you are wondering, what did the dentist put in your mouth? So unfortunately, give me a second. Stop filming, Axel. There we go. Much better. So, as many of you are learning, dentistry is full of toxic materials, and I'm embarrassed to admit that's true. In my practice, I have an integrative practice, a little bit about myself. So I've been practicing dentistry for about 20 years. I am a reformed cosmetic dentist. I spent 10 years chasing cosmetic dentistry, only to realize it's nothing more than modern restorative dentistry. In fact, cosmetic dentistry is not even a specialty, so a lot of dentists that call themselves cosmetic dentists are basically just giving themselves a title that doesn't exist. So I decided that I like pretty teeth, so everything I do is always cosmetic. There's no such thing as uncosmetic dentistry in my world. I happen to be a really good artist, so dentistry is my artistic outlet. I love being a dentist, and I hate the stigma that has come with my profession. And so I spent my entire career trying to change that. 10 years ago, I built a new office, and it was all about helping people who are phobic and anxious at the dental office, because there's a lot of technology out there that makes dentistry comfortable and not the barbaric torture that most of you are familiar with. And over the years, as I have grown and learned about alternative medicine and holistic living, and I've changed, I've also brought that change into my practice. So today I have probably the most modern practice on Long Island, but I also don't dismiss the traditional and alternative medical approaches. I'm finishing up a naturopathy degree, so I'm learning a lot about another way to heal people, and I'm very excited about it, and I'm incorporating that into my dental care. So I embrace the best of modern, and I embrace the best of alternative and traditional medicines. I use Ayurvedic medicine, Chinese traditional medicine, herbal medicine, homeopathy, auricular therapy, energy medicine. It all has a place. I believe it all has a place in healing people. Anyway, so that's what most of you are wondering about, and I still to this day am very surprised that many people don't know that black metal fillings are 50% mercury. It's very obvious to me because I'm a dentist, but it always surprises me how the public is just unaware. And people like you come to these health conferences, really, I applaud you because you're taking control of your health. And I think that's very important. Okay, so back to root canals. So there are a few major arguments with root canals. One is the teeth are dead. So when you have a root canal, everyone knows the tooth is dead. Now it's a dead body part. And of course, dead body parts don't belong in your head. Okay? They're harbingers of bacteria, right? They're toxic, waste dumps. And the root canal teeth release toxins. And they cause disease. Okay? So let's talk about the first one, the dead tooth. Okay. The dead tooth, unfortunately, is a misnomer. Teeth aren't really alive or dead. If you don't like things without, blood supply and nerve tissue in them, then you should rip all your hair and nails out because they are technically dead tissue. Okay? So what's inside the tooth? When you take the nerve out, does the tooth die? Does it turn to that? So what the nerve inside your tooth does, it's an alarm system. It gives the brain an idea of what's happening with the tooth. And that nerve tissue has only one sensation, which is pain. So if you tickle a tooth, you feel pain. If you blow on a tooth, it feels pain. Pain, 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 pain. The nerve tissue only feels pain. That's what the brain is only interested in. That nerve tissue is supplied by blood vessels and connective tissue. Let's look at tooth nerve anatomy. So this is a picture that most people are familiar with when you see a picture of a tooth in a book or an anatomy. And this is what it looks like in real life. It's a three-dimensional structure with many little side branches. And whenever nature finds a good design, nature tends to repeat it over and over again. So just like this tree, there's a main trunk, and there are thousands and hundreds, thousands of little branches. Oh, wrong way. Tooth is the same. You could notice on the tips, there's many, many, many branches, okay? And as dentists, we could only remove the main trunk. Our instruments are only small enough to remove the main trunk. So for many, many, many years, dentists have been using sodium hypochlorite to rinse the tooth out in the futile attempt to remove all the bacteria and the tissue inside the tooth. It's exactly the same as Clorox. In fact, most dentists go to Walbaum's and buy Clorox and stick it in your tooth. Okay, so as far as the dead tooth concept is, what I want to get through to you is that teeth are not alive or dead. And people who say, I have a dead body part in your mouth, they're not really describing it correctly. It's using the wrong language. The real language is there vital tissue, nerve tissue in the tooth, or there isn't? Because what happens is, if bacteria invade the tooth, the nerve, for lack of a better word, dies. But the truth is the nerve becomes necrotic, like all tissues that get infected, gets liquefied and gases are released, okay? When you remove a nerve from a tooth, you remove the alarm system. The tooth remains the same. The tooth is still attached to your body through ligaments and bone. The tooth still has function. It functions like a tooth. You could chew on it, you can speak with it, you can bite people and things with it. Your tooth is a tooth. Its structure is the same. It's a very unique body part. It's basically a rock inside your mouth that you chew with, okay? That's what a tooth is. It's not like your finger. If your finger becomes necrotic and gangrenous, if you don't cut it off, it's gonna spread to the rest of your body and you'll be dead, okay? But teeth don't work that way. So Whoever says, tooth is a dead body part, doesn't belong in your mouth, really is not describing it properly. And the teeth still work like teeth. So I just want to get that point across. So let's talk about the real problem, which is the bacteria. So here's the truth. Conventional root canal therapy cannot and does not remove all the tissue and all the bacteria from inside the tooth. It gets sort of close. And Clorox doesn't penetrate that deep. So most root canal teeth treated today in the United States leave bacteria and tissue inside the tooth. That's why you all have these problems. And even if we can get all the bacteria from the nerve, from the place where the nerve used to live, and all the little thousands of branches, there's still bacteria in the millions and billions of little tubules inside the tooth. This is electron microscope showing you, look at the right, I'm sorry, my pointer's busted. You could stack probably 20 to 100 bacteria in one dental tubule. You could have yeast, bacteria, fungus inside these tubules. And this is what dentists are always leaving in your teeth when they perform conventional root canal therapy. But we have a different solution today.
As we continue virtually downward into the canal, note that the placement of the PIP's tip stays stationary above the canal. The laser energy is activated into the tip, creating a series of shock waves traveling down the entire root canal system to its apical terminus. As this photon-induced photoacoustic streaming activity of the PIP's mechanism continues, a flushing of smear layer and debris can be seen exiting upward from the canal up into the access opening in the coronal aspect of the tooth. This action has been demonstrated over and over in both experimental test models and clinical trials during the irrigation portion of treatment. The resulting surfaces shown by our SAM studies have demonstrated extremely clean surfaces that leave the dentinal wall surfaces uniquely intact. In fact, due to the non-ablative and remote, distant from the apex, mechanism of action with the PIP's laser protocol, our SAM microscopy has demonstrated both hydroxyapatite and even collagen fibers to remain intact and undisturbed morphologically. Traveling further down the canals, we see evidence of lateral canals that are well cleansed and void of tissue and smear layer. The remaining canal preparations show efficacious removal of debris from the entire canal system. This process can be done with less need for over-instrumentation and is extremely minimally invasive. The final preparations offer the clinician a more biomimetic surface for obturation and restorative adhesion.
Okay, so as you can see, we have now a laser technology that allows us to use photoacoustic effect to remove all vital tissue and bacteria, not only from every side branch of the nerve where nerve used to be, but also from the dental tubules. And that is critical. So I'm going to show you a real life example of what actually happens. This is a kind of a synthetic looking tooth, but what it demonstrates is the real life, before you saw a cartoon, so you're gonna see a real life what happens. So as you can see, the laser tip is on top, but the photoacoustic effect is able to go into all the side branches of the synthetic tooth and remove the gel, the red gel that's there. And if you keep it there long enough, you'll see it all will come out. So this just demonstrates the photoacoustic effect. Okay. So the laser is probably good enough to kill all the bacteria and to remove all the tissue from the tooth. But I also have ozone. I use ozone therapy a lot in my practice. And what ozone does, it selectively kills all germs, all prokaryotic organisms. Bacteria, fungi, yeast, even prions. But it's safe to the eukaryotic cells, which is what we are. Because our cells, in its cell membrane, have systems that neutralize ozone. In fact, our own cells, our immune cells, use peroxides, ozone, made from ozone, to kill bacteria. That's how the blood white cells kill bacteria. They use ozone. So what we use in my practice, we use the PIPS protocol. And by the way, there are a lot of lasers out there. There are a lot of dental lasers out there. Unfortunately, there's only one laser that uses the PIPS technology, okay? So you could stick, a laser pointer in a tooth and call up doing laser dentistry, but it's not the same. You have to use the specific technology that has been designed for this specific technique, okay? There's a number of lasers out there that don't do this, and I know root canal therapists are using different lasers and say they're doing laser root canals, but it's not PIPS. PIPS is a patented technique. So we actually, instead of using Clorox in your tooth, we use ozonated water, which is chemical free. It has no breakdown products. It breaks down to oxygen. So that's safe, right? And once we finish everything, we dry the tooth, we then use ozone gas to fumigate, which will go into all the little side channels and all the dental tubules. So, I've had a lot of my colleagues tell me, why are you doing double duty? And my answer is, because I got both, and I like belt and suspenders. I want to be damn sure that all the bugs are gone. So the other part of the puzzle piece of doing safe and healthy root canal therapy is sealing the tooth with materials that are biocompatible and non-toxic. So we use a cement, a bioceramic cement, that actually bonds to the tooth and bonds to everything else. So we're really achieving a monoblock restoration. We're sealing the whole tooth, and everything is fused to itself, to each other, I should say. So we use a natural gutta percha, which is a natural rubber material, which is actually embedded with bioceramic particles, so it actually bonds to the cement. There are some gutta percha that have toxic materials in it. This specific product is all natural, and it has, the only thing synthetic is the bioceramic material, bioceramic glass, that actually fuses with the cement. So we have no gaps. It's all adhered to each other. Okay? So once you've sealed the root with the cement and the sealer, what every dentist in the United States does is they put a piece of cotton inside your tooth and a temporary filling and say, see you later. Come back in a few weeks, we'll give you a crown. Why do they do it? I'm embarrassed to tell you, money. A lot of root canals are done by specialists. Their referral source is the restorative dentist like myself. If they do the next phase of procedure, they are taking money out of my pocket. And if they do that, I will never, ever refer to them again. So they'll never do it. In my office, I have a trained laser root canal therapist. And I don't care if he seals the tooth at time 0, because I care more about having great results and healthy patients than how much money I make. So, like I said, all temporary fillings leak. So what happens is now you just did the sterile disinfection, sealing, all the stuff, and when you put a temporary filling on, you take the rubber shield off that keeps the saliva from contaminating the tooth, and guess what happens? Your tooth is bathed in saliva, and all temporary fillings leak, and within 25 days, that bacteria has percolated down the tooth into the bone. And that is why root canals, even if it's done with a laser or ozone or both, will fail years later. And this is a cover of the second most prominent dental journal in the country, and you see these blue dye staining studies that basically show that every temporary filling leaks. So I'm not making any of this up. So the way we treat it, like I said, is I have a root canal therapist who's trained as a biomimetic dentist, which is, in biomimetics, if you read the article in the magazine today, is basically rebuilding teeth to emulate nature. So using synthetic materials, because that's all we got, that are as close to nature as possible in their physics. That way the restoration works in harmony with your tooth and not against it. And that's very important for the longevity of your teeth and the restorations that are put in your teeth. So we seal the tooth while it's still in a sterile field. And that, my friends, is the key. So you gotta kill all the bacteria, remove all the tissue from inside all the branches of the nerve where the nerve used to be, kill all the bacteria in the tubules, and then hermetically seal the tooth from the tip to the top. If you can achieve that, you've got success, my friends, and that's what we do. So, another argument I hear all the time, even from some dentists, is they say, well, after if you do the perfect root canal, doesn't the bacteria get back into your tooth somehow? And, sorry. They say, the bacteria in your body will recontaminate your root canal. The problem is it's not biologically possible because you see your teeth, the roots of your teeth are coated with something called cementum. The reason it's called cementum, it's like cement. So there are no pores in your teeth that go to the outside. Your tooth is the root is coated with a cement-like substance where the billions of little ligaments insert, because your teeth are not fused to your bone. They're actually suspended by billions of little tiny ligaments inside your bone, almost like a trampoline, because teeth need to be shock absorptive. If they're not, you'll crack your jaw. You know, your facial muscles are the strongest muscles in your body. So the tooth is basically sealed biologically inside, and if you hermetically seal the tip of the tooth with bioceramic cements that fuse to the tooth, and if you adhesively seal the tooth from the top before saliva ever touches it, you can create a hermetically sealed tooth that no bacteria will get into. If bacteria could get into teeth naturally through these pores that I don't know where they exist, but apparently there's pores that do that, and all your teeth would be infected all the time, but they're not. So, the solution. Seal the tooth with non-toxic biocompatible materials. And stop any microorganisms from invading a tooth. So, disinfect and seal is the name of the game. That way nothing will be leaking out of your tooth into your body. So, any questions on this part so far? Yes?
Does the average dentist do it?
No. Actually, I developed this technique in my practice over several years by taking advantage of the technology that became available. So, first came the laser. Actually, first came the immediate sealing of the tooth at the time of root canal therapy, because I was reading studies over the past 10 years where they went something like this. Well, if you restore a tooth after root canal within a month, success rates go up by 5%, 10%. Then another study came out a few years later. Well, if you seal a tooth 3 weeks after, it's better. And then another study came out. Well, if you wait 2 weeks and seal it, it's even better. Like, well, screw it. I'm not going to wait until the next study comes up. I'm just going to seal the damn thing immediately, because today we have adhesive technology that fuses synthetic restorations to teeth. So we have a way to seal the tooth very well. Then came out the laser, and then I got the ozone, and we've had incredible, incredible success. Yes? We don't charge any more for it. This is just how I do dentistry. My fees, if everybody asks me how expensive I am, my fees are average for my area. You know, this is my world. This is how I do dentistry. This is how dentistry should be done, in my opinion. So that's how I do it. It's very simple. Yes? Yes, but let's stick to the lecture. Yes? Because I have electron microscope studies to prove it. So everything I do and tell you, you don't have to believe me, you can check for yourselves, but everything I do is based on science. I don't believe in conjecture, because conjecture is not how you should how you should medically treat people. Everything I do, all the materials that I use, are supported by studies and science. Because I live in the world of science and I need proof to show efficacy of what I do, otherwise I'm just conjecturing. Correct. Because, like I said, there are many clinical in vitro and in vivo studies that show this. Okay, the root canal skull cancer. Oh, sorry. I've been around. I've been using the PIPS protocol and the immediate sealing of teeth for about 10 years. We've introduced ozone into my practice about a year ago. Like I said, I'm not really sure it does anything extra, but because I have it, how could I not use it? All right, the root canal skull cancer. So if you go to Dr. Mercola's site, he has this big article on how root canal skull cancer, and the study goes something like this. They took 100 people with cancer, and they looked in their mouth, and like 98% had root canals, or 90% had root canals. And they go, aha, root canal skull cancer. But if any of you is a scientist, you know that correlation is not causality. A lot of studies that you read about, like meat causes cancer, these are correlation epidemiological studies. And any scientist will tell you that correlative studies are not proof of anything. Correlative studies are a means to develop a hypothesis onto which you'll have to develop a double-blind experiment which proves or disproves your hypothesis. Correlation. So there's a correlation that whenever there's a house on fire, there are lots of firemen within a half an hour of the fire. So firemen cause fire, right? No, it's stupid. You know, people who are very obese wear big belts. That's a correlation. Does that mean belts cause obesity? That's stupid. This is just as stupid. It proves nothing. And the truth is, a lot of people, you know, let decay get out of control or crack or break their teeth, and they need root canal therapy if they want to save their tooth. 95% of the population's got a root canal. It doesn't prove anything. That's my point. If you want to prove it, you have to have a real experiment that's designed to prove it, which doesn't exist. It's just a correlation. You know, there was a time when the earth was flat, and if you go far enough, you'll fall off the edge of the earth. And then we learned it was different. But I will tell you this. We all know that if your body is battling a chronic infection in your body, it's taxing your immune system. It takes a toll on your body. So if you have an infection somewhere else, or if you have cancer somewhere else, and your body's fighting a war at two fronts, it can't give 100% of itself to treating or to battling the cancer or another disease. So I don't know if root canals cause cancer, but I do know that chronic diseases in your body take a toll on your immune system. And so being healthy in general is good if you have cancer. That way your body could spend all its energy fighting the cancer. So If you have a root canal that's done conventionally and it's leaking bacteria into your bone and you have a chronic bone infection, I think it's a problem. And I think by not having that infection, your body will be healthier and you could probably fight other diseases better. That's what I think. Okay, so is there an alternative to root canal therapy in the first place? Well, here's the thing. Once your nerve becomes necrotic, all bets are off. But what happens is, if dentists follow a conventional approach to treating teeth, they have to remove all the decay. So there's many people with very deep cavities that are really close to the nerve. And every dentist knows that if you dig all that decay out, the nerve is gonna become necrotic and die. And again, I hate using the word die, but I'm just so used to it. I'm sorry, it's the way it is. But I think you understand what I'm saying. So, what if we can do something? If we can establish that the vitality of the nerve is good, in other words, if the nerve is still healthy, but you have a deep, deep cavity really close to the nerve, can we address it in a modern fashion using modern techniques, modern thinking, and modern materials to avoid nerve death for our patients? And fortunately, that exists today as well. So the new strategy, and the strategy that I use in my practice, is we remove all the decay until the last bit that's close to the nerve. And how do I know I'm close to the nerve? Because I measure. Because you can measure X-rays. We have 3D X-ray technology that allows us to know exactly where I am in the tooth. So I know where I am from the top, and I know how far I can go until I can't go no more. So you can actually, so in dentistry, if you leave decay in a tooth, you're a bad dentist. But if you could leave decay in a tooth, sterilize the decay, remineralize that softened part of the tooth, reharden it, heal it, and then restore the tooth, wouldn't that be awesome? So the technique that I use to sterilize decay is ozone, because ozone penetrates deep into the tooth, deeper than anything, because it goes down the tubules. And it effectively kills every microorganism, every pathological microorganism. Kills everything, except human cells. Isn't that great? So how do I know I kill those bugs? Well, I get to use a really awesome technology, which is what this is, the Spectra system. The Spectra system is a visual technology of a technology we've had for about a decade, where it uses laser to fluoresce the bacteria. So live bacteria fluoresce under this specific laser, and what the Spectra system did is it translated that reading into a visual and a numerical image. So green is good, blue is getting not so good, red's really bad. So I'm going to show you an example. So here you go on the left side, we cleaned the peripheral decay out, and what you see there is the red, which is the still live bacteria in the softened part of the tooth. And after 5 minutes of ozone fumigation, we got green. All the buggies are dead. Now, how long do we apply the ozone for? It depends. I don't know. Some teeth take a minute, some teeth take 5 minutes, and sometimes it takes 10 minutes. But we keep taking the pictures with the Spectra system until we get all green. I know everything is dead now. It's soft, it's demineralized, it's sterilized decay. And then we use a material that basically supplies the building blocks of tooth structure to the tooth. And guess what? Your teeth are biologically heal themselves. If you give them the right environment, and if you give them the right raw materials, the tooth will reharden or remineralize. So we apply this material. It's a new class of materials. It's a resin-modified calcium silicates. There's a number of them on the market. This is made by a company that I've trusted for many years. I know they've been developing this product for 10 years. They have 10 years of research of its efficacy. I like research. I like proof. And then we rebuild teeth biomimetically, meaning we use synthetic materials that emulate nature. Because in my world, nature reigns supreme. Nature gets it right. Nature took millions of years to design our teeth. Our teeth have not changed in the past 350,000 years. Do you think human beings are better than nature? You think we're smarter? No way. So instead of trying to reinvent the tooth, I just copy what nature makes. And so teeth have different layers in them. And I use different materials that are BPA and BSA free, that are as non-toxic as I could find, that work like the tooth. And different layers of the tooth work differently. So I use different materials to mimic that structure. That way my restorations are in harmony with nature, that are in harmony with the tooth, and not some haphazard physics that works differently. And the proof is in the way dental restorations fail. So if you stick metal inside of a tooth, your tooth will break and crack because metal is too rigid. It acts like a wedge inside the tooth. Unfortunately, my entire profession is basically based on 1800s dentistry, where they used woodworking techniques and cast metal techniques to rebuild teeth, because that's all they had in the late 17 and early 1800s. And that is still the techniques that are used today in dentistry. They're taught in every dental school. But it's 2014, ladies and gentlemen, and there are incredible advances in material technology and material science that allows us to be better, to be more natural and less toxic, more minimally invasive and more tooth conservative. And that is my religion in dentistry. That's my world, and I love it. So biomedical dentistry is a new dental paradigm. There's only about 250, maybe 275 now dentists in the country, probably the world, that practice this way. And I'm so passionate about this restorative, new modern restorative approach that I helped to start the Academy of Biomedical Dentistry so we could have strength in numbers. So as more dentists join our ranks, we could force dental material manufacturers to create materials that mimic nature. And they're beginning to listen. Last year, another product came on the market that is very, very biomimetic. Unfortunately, it's kind of ugly. So I use that inside the tooth. Because it's not just enough to use the right materials. It's also very important to rebuild the tooth the way nature made it. Because you see, nature does not waste energy. All the little cusps and all the little grooves and all the little shapes of your teeth, they all have a purpose. If they didn't, nature wouldn't have it in your teeth. But most dentists restore teeth like little buckets or blobs with amorphous blobby fillings that have nothing to do with how nature made your teeth. It is no surprise that a lot of humans have TMJ problems because dentists don't take the time or don't have the patience, or I'm not sure why, we don't rebuild teeth to mimic nature. In nature, form follows function. If the form is wrong, so is the function. If the function is wrong, you're going to have the wrong form. You have to have both. So I like natural, pretty dental restorations because that's how nature made them. Thank you. Any questions? I have 3 minutes left, but if I'm available, on both.
After you fill it, is it okay?
Not if you do it right. There is pain when something went wrong. Most dentists treat white fillings like white amalgam. It shocks me that dentists use amalgam techniques to replace white fillings. They just go, oh, black, white, whatever, same thing, stick it in the hole. But white fillings follow completely different restorative methods. And there are literally hundreds, if not thousands, of bonding agents and white dental materials. And each one has its specific nuances. I have several different adhesives in my office. I have several different composites in my office. I treat all of them a little bit differently because I have to. If you treat it all the same, you're gonna have problems and failure. And I know we got like 3 more minutes, but so metal fillings are too rigid and they break teeth. How many had a tooth break around a silver filling? I'm surprised more of you didn't raise your hands, or you just didn't know. The problem with white fillings is the opposite. White fillings are very flexible. Okay, I should say white fillings are relatively flexible to the teeth. So when you put a gummy bear inside of a tooth and you chew on it, what happens is the filling deforms a lot greater than the actual tooth. And the bond or the seal between the tooth and the filling tears and rips, and you get what you've heard of as leaky fillings. You get micro leakage. So what happens back to root canals is if you put a restoration on a tooth that is not bonded properly, or you have a crown on the tooth where the cement washes out because the dentist used the old-fashioned concrete type of cement versus the modern resin bonded cements, and that cement seal breaks and the restoration begins leaking bacteria, then you will recontaminate your tooth. Now, what the slide I didn't have here is we use a 3D X-ray technology, which is ultra-low radiation, that allows us to see the tooth in 3 dimensions. So the way we evaluate root canal is, mine and other dentists, is we take a 3D scan and we look very carefully around the tooth. And if there's micro leakage, the bone will die. So very often you have infections left over or continue from teeth that are leaking bacteria and toxins into the bone. The body responds by being sick. So the problem with 2-dimensional x-rays is they don't show that infection all the time. It shows it when it's really big, or it shows it a little bit. But once I got the 3D x-ray into my practice, my world changed. I started seeing a lot more problems. So I became a better diagnostician because of the technology that's available today. So we carefully evaluate all teeth that have root canal therapy because most of them are causing infections, okay? And the ones that don't, you know what? The dentist got lucky. We get lucky sometimes. Sometimes medicine succeeds in spite of us, and that's true. So not every root canal is evil, but if you have a root canal in your mouth and it doesn't feel right, listen to your body. I'm a big proponent of listening to your body. Each one of us have been living in our bodies our entire life. We know what feels right and we know what feels wrong. And so don't let every doctor tell you that there's nothing wrong with you when you damn well know that you do. And that is one of the most important things I've learned in my career. Listen to the patient. The problem is doctors either have not enough experience or not the right technology to make a proper diagnosis. And it's all about the diagnosis. There's only one diagnosis. If you misdiagnose, you're treating the wrong thing, my friends, and that's bad. So technology today allows us to be better diagnosticians. So I embrace the modern dentistry. I embrace modern technology, but I never forget about traditional and alternative medicine because that's been used for hundreds, if not thousands of years, and it has a place. Thank you.